So I am Dr. Prashant R. Reddy. I am a ENT surgeon who also deals with specifically in the nose and also with the snoring. So I specialize in taking care of patients who are having snoring, and I cure them of their snoring. So sleep apnea is nothing but as it sounds. When you're sleeping, apnea means a terminology, a clinical terminology, which is used for telling that you stopped breathing. So apnea means you have stopped breathing. So sleep apnea means you have stopped breathing when you're sleeping. So sleep apnea occurs. The more common symptom of a sleep apnea would be snoring. More than the patient, the spouse or the people surround in the house would be telling that okay, you do have a lot of snoring. So this is something which the patient directly doesn't understand. Indirectly, the patient will notice that he has excessive amount of daytime sleeping. He will be always, he or she will be constantly fatigued. He or she can't focus on the work. Their concentration is very, very poor. They are very, very irritable. And most of the times they'll be exercising and doing the diets and everything, but unfortunately their weight is still not going down. That's all because of sleep apnea. Sleep apnea is something which we can diagnose by assessing the patient. We need to do the assessment of the nose, we need to assess the throat. There's something called as a sleep test, or sleep apnea test. So they will do the testing by attaching few leads at home, and they'll record your sleep overnight. So with that assessment, we'll see the index as to how many times you have stopped breathing over the whole night. So people who have severe sleep apnea, they will stop breathing for more than 10 to 20 seconds, and that causes a lot of bodily changes, such as the stress on the heart increases. Because they are not breathing, the amount of concentration of oxygen, carbon dioxide in the blood will be high. Secondary to that, their heart rate will be fluctuating. It can either go very, very high or it can go very, very low. It also leads to release of lot of inflammatory reactions, inflammatory mediators, which increases the inflammation in the body. Secondly to the inflammation in the body, there will be high amount of cortisol which is released. So cortisol is nothing but the stress hormone. Because of the stress hormone being released, the patients will put on more weight, because cortisol is nothing but a natural steroid which is secreted by your body, and everyone knows when they have excessive amount of steroids, that will increase their fat in the body. That's why I mentioned that patients who are obese, they still are dieting and exercising and everything, but still they are not able to burn the fat because of all these issues. Because main thing is the cessation of breathing and the inflammatory mediators which are increasing and the stress hormones which are increasing in the body. So the primary cause for snoring is because of the nose obstruction. Because the nose gets obstructed, what happens when they sleep in the night, the nose is fully blocked. Obviously, they have to breathe. So they open the mouth. So when they open the mouth, the tongue falls back, and that causes the snoring issue. Because they start breathing through the mouth, when the tongue is locked, like you can see the jaw is when it's closed, the tongue is in a locked state. So it doesn't fall back. You know that the tongue doesn't have any bones in it to keep it intact. So because the jaws are open and not closed in a locked state, so when that happens, the tongue falls back. Second to the tongue falling back, that leads to more drying of the secretions in the mouth. Second to the drying, what happens, there will be more amount of blood which goes to your tongue. And tongue being a muscle, when there's more amount of blood flow, it becomes thicker in size. That leads to further obstruction. And also when the tongue falls back, the palate, the soft palate, that also increases in size. So because that's increasing in size, that also leads to the obstruction of the oropharynx, in the oropharynx, and also in the nasopharynx. Nasopharynx is the area behind the nose. So as you ask, what are the causes for snoring? I can classify it as four different levels. One is the nose, one is behind the nose, one is the oropharynx, and the fourth one is the throat, or the lower part of the throat. So these are the causes I explained. One is the nose. One is gets obstructed, the mouth breathing occurs. Second is secondary to the enlargement of the tongue and the soft palate, secondary to mouth breathing, that also causes obstruction in the throat along with your tonsils. The tonsils, if they're big, that will also cause obstruction in your mouth or oropharynx. In the throat, if there is more amount of girth of the neck is too big, the bulky neck, that also compresses the trachea and that also causes snoring. So these are the four levels or four different phases secondary to snoring. Yes, definitely there are solutions. First and foremost, lifestyle changes. What is the major cause for snoring is weight. When patients are excessively overweight, that causes snoring because of the neck compression and also the tongue becoming thicker. So weight loss will help reduce the snoring. Second is ensuring that the nose breathes, because that is the primary cause for snoring. So if the nose block is there, get your nose checked by the ENT surgeon. Let them assess it by doing an endoscopy of the nose to see how the bends are, if there is any polyps, if there is any inflammation, if there is any other issues inside the nose, is there any collapse in your throat. All those things have to be assessed systematically. Thirdly, we'll have to get a CT scan to understand how the sinuses are inside the face. If there's sinusitis also, that also leads to inflammation and that also leads to increased amount of snoring. Fourthly, we'll have to go for a sleep test. So we'll have to assess how you sleep. Fifthly, we can do a drug-induced sleep endoscopy, DISE. That means we'll give you some injection and make you go to sleep. At that point of time, we'll pass a flexible scope through the nose and into your throat to see what areas are actually collapsing. Accordingly, we can address it. But all these things are customized. It is not like everyone has to go through all these tests. Based on a proper clinical examination, we can diagnose it and address it accordingly. Yes, there are three types of sleep apneas. One is the obstructive sleep apnea, which I just described. One is a central sleep apnea, which is because of the brain malfunction, where the brain doesn't actually synchronize. There's something called as a respiratory center in the middle brain, so brainstem. So that is malfunctioning. That causes centralized apnea. Third is a complex one, which is a mixture of the central and obstructive together. If you've gone through this video, if you have any sort of questions or queries related to sleep apnea, do type into the comments so that we can get back to you accordingly.